Welcome to the segment of our learning series on the 2024 Medicare Promoting Interoperability Program. This series focuses on the requirements for eligible hospitals and critical access hospitals. This information was current at the time of this recording. Medicare policy changes frequently, so please visit the CMS website for the latest updates. This segment will provide more detailed information on the requirements for the objectives and their associated measures. There are 4 objectives, each with their own measures, options, and scores. From these 4 objectives, you must report a minimum of 60 points. A reminder that the reporting timeframe is now a minimum timeframe of 180 continuous days that is a self-selected timeframe. You need to have everything ready by July 4th, 2024 for objective measures at the latest to meet this measure. Objectives. This table shows each objective with the available measures. It also identifies which measures are required and how many points are available. You must submit data on all of the required measures. For the objective measures, the reporting period must be a 180-day continuous period in 2024. The reporting period must be the same for all measures. The measures that require a numerator and denominator to be reported, the numerator must at least be a 1 to count for any points. The objective measures that require a yes-no attestation, a yes is required to receive the points. Electronic prescribing objective. You must report on both measures within the objective. The query of the Prescription Drug Monitoring Program measure is required for Schedule II opioids and Schedule III and IV drugs. The electronic prescribing measure means utilizing your certified EHR to electronically transmit prescription orders. This measure is worth up to 10 points. You will submit the numerator and denominator for this measure, and exclusions are available. If you claim an exclusion, the 10 points will be redistributed among the HIE objective measure. Query PDMP. For at least one Schedule II opioid or Schedule III or IV drug electronically prescribed using certified EHR technology, you must conduct a query of the Prescription Drug Monitoring Program. This is worth 10 points and is a yes or no attestation. There are exclusions available. If you claim an exclusion, the 10 points will be redistributed to the e-prescribe measure. Health Information Exchange Objective. There are 3 options to choose from underneath the Health Information Exchange Objective. You can choose Sending and Receiving Information, which is Measure 1 and 2 listed in the table for a combined score of 30 points. Or you could select the HIE Bidirectional Exchange for 30 points, or enable exchange under a Trusted Exchange Framework and Common Agreement measure for 30 points. You are required to choose one of these 3 options. Sending health information. If you choose this measure, you also have to choose a second measure for receiving and reconciling health information. This measure requires that you use your certified electronic health record technology to create a summary of care record and electronically exchange this record. You will submit the numerator and denominator data for this measure. It is worth up to 15 points. There are no exclusions available for this measure. Receiving and reconciling health information. If you choose this measure, you have to choose the first measure for sending health information. This is Measure 2. This measure requires you to utilize your certified electronic health record technology to reconcile patient information that you receive electronically. You will submit the numerator and denominator data for this measure. It is worth up to 15 points. There are no exclusions available for this measure. The HIE Bidirectional Exchange. You could choose this measure, and it is the only one you have to report on for the HIE objective. If you belong to a local, regional, state, or other health information exchange, and you are actively sending and receiving data, you meet the requirements for this measure. This is a yes-no attestation measure and is worth up to 30 points. There are no exclusions available for this measure. Enable exchange under the Trusted Exchange Framework and Common Agreement. You could select this underneath the HIE objective. If you choose this measure, it is the only one you need to report on for the HIE objective. It is a yes-no attestation and is worth up to 30 points. There are no exclusions available for this measure. Provider-to-patient exchange objective. There's only one measure underneath this objective. It is required for reporting. It is regarding providing patients electronic access to their health information for 25 points. This required measure is to provide electronic access for your patients to their health information through your certified electronic health record technology. You will submit numerator and denominator data for this measure, and it is worth up to 25 points. There are no exclusions available for this measure. Public Health and Clinical Data Exchange Objective. There are 5 measures within this objective. You must have registered with the Public Health Agency or Clinical Data Registry within 60 days after the start of your PI reporting. For 2024, antimicrobial use and resistant surveillance is now required as well. There's the opportunity for 5 additional bonus points as well if you are in and report your level of active engagement for public health or clinical data registries. Public health measure and clinical data exchange level of engagement terms. Here are the options and requirements for reporting your active engagement for the public health and clinical data exchange objective measures. The eligible hospital or critical access hospital must report on all 5 measures underneath this objective. Regarding your reporting, there are requirements to report your active engagement for your public health and clinical data exchange objective measures. The eligible hospital or critical access hospital must report on all 5 measures. They include yes/no attestations, level of engagements. The scoring is a total of 25 points for all measures. It is required to report on all 5 measures. The immunization reporting measure is required along with the reporting level of engagement. This is a yes/no attestation, and there are exclusions available. This is one of the 5 components that must be met within the Public Health and Clinical Data Exchange Objective. Syndromic surveillance reporting. This is one of the 5 components that must be met within the Public Health and Clinical Data Exchange Objective. This reporting measure is required and includes also the level of active engagement. It is a yes/no attestation, and there are exclusions available. Electronic case reporting. This is one of the 5 components that must be met within the Public Health and Clinical Data Exchange Objective. It is a required measure that is a yes/no attestation with exclusions available. Electronic reportable lab results reporting. This is one of the 5 required components that must be reported on within the Public Health and Clinical Data Exchange Objective. This is a required measure that is a yes/no attestation with exclusions available. AUR. This is a new required measure within the Public Health and Clinical Data Exchange Objective. Eligible hospitals or critical access hospitals are required to be in active engagement with the CDC on their National Healthcare Safety Network to submit antimicrobial use and resistance data from their electronic healthcare within the reporting period they select. You will receive a report from NHSN indicating successful submission of AUR data for the EHR reporting timeframe period. To meet this requirement, the NHSN user interface includes an AUR promoting interoperability program registration of intent page. Your NHSN facility administrator has access and is required to register for the facility's AUR PI program intent. This is the documentation you will need to keep on hand and is required to meet the public health registry measure. Bonus measures. There are 2 measures that can provide bonus points for the public health and clinical data exchange objectives. These optional registries include the Public Health and Clinical Data Registry. Both require you to be in active engagement with a public health agency to receive these total of 5 bonus points. This concludes the information regarding the objective measures. The next segment will provide more detailed information on the Protect Health information requirements. Thank you.